The World Health Organization has been very bullish about this new law. You've read the law, of course.
Yes.
Could you maybe tell us what are the biggest pluses in the law?
Yeah, thank you, Ami. It's first off, thank you for inviting the World Health Organization to your program. And this is a very challenging question always. How do you summarize close to around 30 to 40 provisions spanning a lot of the building blocks of health systems? And it's definitely not just a PhilHealth law. People mistake it to be just a PhilHealth law. If there are 4 key points, one is, yes, we acknowledge that you will be increasing the fiscal space. That's what Dr. Gigi said. We're going to get from the syntax, the PCSO funding, yung dating pinipilaan. So, imbes na nagkakaroon pa ng letter of guarantee, gradually, if i-phase out na rin yun, tapos dapat tataas na yung share ng PhilHealth because of PCSO. Also, PAGCOR. And then, of course, the existing budgets. That's one. But more than that, we're also going to increase the capacities of the system to deliver, yung sinasabing supply side. I think one of the under-highlighted provisions would be the involvement of the private sector. And when we say here involvement of the private sector, there has this perspective now always RHU, Rural Health Unit, City Health Center. That's fine. We will also have provisions for that. But what about the existing private sector? And when we say existing, hindi ibig sabihin yung malalaking ospital lang. Even individual doctors who will set up a small clinic, mga lying in sa probinsya, ganyan. How do they actually join in? And it was mentioned earlier that there will be a network, what you call a healthcare provider network. This network is supposed to solve a lot of the problems of passing patients around. Ang daming mga kababayan natin na sasabihin, hindi ko nalang pupuntahan yung center na to kasi alam ko naman ipapasa rin ako dun sa kabilang ospital. So didiretso nila ako dun sa ospital. Now, if there is a network and these individual facilities and providers actually talk to each other, and not just talk, but share a common fund, there's a provision there for a special health fund, so to speak. Then the idea here is there should be better coordination and not just lip service. So apart from that also, there's health promotion. People also don't realize that within this law, there is a particular provision on health promotion where it's not only just about hospital services, about going to the clinic, but even campaigns like vaccination, like cleanliness and sanitation, like even lowering the amount of salt and lowering the amount of fat in the diet. Preventive measures. There's health promotion. Apart from health promotion, there's also an interesting provision there on health technology assessment. Because down the line, let's say that PhilHealth does its job very well, the DOH does its job very well, and the system is working. Of course, medical technology will always evolve. There will be new drugs, new devices, for all we know, new diseases and new treatments. But not everything will be cost effective. So the question becomes, what is the government going to pay for? And health technology assessment is going to assemble a council of eminent persons, not only technical, but also from patients groups, from stakeholders. In other words, there's a balanced composition. They look at the evidence, they will say, this particular drug, this particular device is cost effective and should be paid for. Or maybe this particular drug will not really add some benefit, it's actually more expensive than current treatment, so let's not pay for it. So I once heard an undersecretary say, it's just like a family budget. If the money is about to go up, now the mother or the father has to learn how to decide which to pay for.
We want to know exactly what the law covers. What types of treatments? Does it cover, for example, drug abuse rehabilitation, reproductive health care? What types of treatment? Surgery, in terms of surgery, very expensive.
So the way that the law was written, or is written rather, the current benefit packages of PhilHealth will remain. So wala dapat diminution. So it's the same benefit. So if you do have existing benefit packages, hindi mo wala yun. PhilHealth has what they call case rates. There's quite a number of cases. It's a different question on whether the rate is commensurate to what the cost is. That's a different question. But as to the spread, it's a fairly sizable number of conditions. Now, perhaps the question gets extended. Are we going to add more conditions to this? And you did mention specific examples like drug rehabilitation. I would even hazard to say smoking cessation. And lifestyle change, is it going to be included?
And mental health
Mental
care.
health.
Mental health care, exactly. That's a very big, especially
it's a
with
new
the
law.
new law.
It's a new law.
Exactly. Oh, by the way, the cancer control law was also signed
Yes, yes.
a few days before the UHC
So
bill.
is it covered?
Now, this is the question, or rather, this is the answer. The health technology assessment part of the universal healthcare law was Congress' way of delegating the decision-making power on which to cover to the Health Technology Assessment Council. It has to be formed. There is a rudimentary already group doing it inside DOH. In fact, they do issue advisory opinions on certain drugs. Ginagawa na nila. Pero as in yung fully operational na meron talagang independent council na not even under DOH but under DOST. In the UHC law.
Multi-sectoral yan.
Multi-sectoral, and important yun na under DOST. To be honest about it, and you can read it in the congressional record, this comes from the experience with Deng Vaxia. Kasi sabi nila, dapat iba ang nag-check sa DOH at sa PhilHealth para may balancing.
So that's a new body. This is the NHTC. Am I tama ba?
HTAC, Health Technology Assessment Council.
Oh, so if we were to backtrack a bit, kanina you mentioned just in passing that one benefit to enrolling everybody and one benefit to letting everybody at least have their checkups and lab tests is we're going to be generating a ton of data.
Yes.
So that council is essentially going to be formed so that we can take that data and deal with it in real time and in a dynamic way. It can basically change directions or priorities as we see the data coming in?
That is the medium to long-term goal, and thanks for reminding me on the data aspect. Also within this UHC law, para siyang every time you open something, something comes out, but it is inside, lahat ng sinasabi ko. There is also a provision that will now require all healthcare providers to submit health information, subject to the data privacy laws and all that, but they should submit it to PhilHealth.